Hello, I'm Brianna Rogers, and today I'm going to be talking about the National Athletic Trainers Association position statement on exertional heat illnesses. It's very likely that many of us will be working outdoors with athletes, so to guide your practice, you can use this to recognize exertional heat illnesses, potential risks that can make them more likely. You can also use this for treatment recommendations and for the development of return to play protocol. Take note that exertional heat illnesses is abbreviated as EHI. The types of exertional heat illnesses were defined and differentiated. They all have their own physiological changes that are not mentioned in this presentation. These are just the basic definitions. So an exercise-associated muscle cramp is sudden involuntary contractions of skeletal muscle during exercise that are painful. Heat syncope is dizziness that occurs in an unfit or unacclimated person who's been standing in the heat for a long period of time or has made sudden changes in posture. Exertional heat injury is characterized by organ and tissue injury sustained from high body temperature. An exertional heat stroke is neuropsychiatric impairment and high core body temperature. Heat exhaustion is the inability to effectively exercise in the heat. Knowing all these definitions will help athletic trainers recognize what exertional heat illness is occurring, how to go forward with treatment, and what to do for further prevention. It's important to conduct pre-participation screenings to identify those with risk factors for exertional heat illness and ensure that individuals are gradually acclimated to the heat. The figure on the screen was included in the position statement, and it's the NCAA's heat acclimatization guidelines. Screenings and heat acclimatization are necessary for prevention. The primary treatment recommendations are specific to each type of heat illness. For exercise-associated muscle cramps, stop exercise and activity and give the individual sodium-containing beverages. For heat syncope, the patient should be put in a supine position and their legs elevated to restore central blood volume. For heat exhaustion, cease exercise and activity. Remove the patient from the hot environment, elevate their legs, and give them fluids. For exertional heat stroke, immediately immerse their whole body in cold water to quickly reduce the body's core temperature. Time is of the essence with that one. You must do that within 30 minutes. This information can be used to determine the best course of action for each exertional heat illness. To return to activity for any type of exertional heat illness, it's recommended to have 7 to 21 days of rest, normal blood work, and physician clearance. The patient may gradually be returned to activity under the supervision of an athletic trainer or other trained medical professional. By having return to play progressions, residual complications can be monitored and identified, and the individual can be reacclimated. There are two categories of risk factors. Environmental risk factors for exertional heat illnesses are humidity, environmental temperature that is greater than the body's skin temperature, athletic equipment, and excessive clothing. Non-environmental risk factors include, but are not limited to, untrained individuals, dehydration, increased body mass index, heat acclimatization, and history of exertional heat illness. When these risk factors are identified, prevention measures can take place. Acclimatization should be gradual over the course of 7 to 14 days. The greatest risk of exertional heat illness is during the first 2 to 3 weeks of preseason. For fluid consumption and replacement recommendations, body mass loss should not exceed 2% over the course of a game or a practice. Residual complications can last for months if treatment is delayed, so that means it was not provided within 30 minutes. If rectal temperature is greater than 105 degrees, treat it as an exertional heat stroke. The goal should be to lower the temperature to 102 within 30 minutes. Rectal temperature is the gold standard for determination of body core temperature.